It's the Ralph Nader Radio Hour.
Stand up, you've been sitting way too long.
Welcome to the Ralph Nader Radio Hour. My name is Steve Scrovan, along with my co-host David Feldman. Hello, David.
Good morning.
By the way, David, we have two doctors on today, and I don't want you asking for free advice. I know you like to do that when we have doctors on. All right?
No comment.
And we also have the man of the hour, Ralph Nader. Hello, Ralph.
Hello.
We have another fascinating, informative show for you today. First up, we welcome back Dr. Steffi Woolhandler. Dr. Woolhandler is a co-founder and board member for Physicians for a National Health Program, which is the leading association of doctors and other health professionals that advocates for Medicare for all. This topic of national health insurance used to be a taboo subject in national media until only a few years ago. It's still coming under attack in the corporate media, which of course relies on health insurance and pharmaceutical companies for a tremendous amount of their advertising dollars. Just turn on CNN at any random time. That's pretty much all you see. And the Democratic presidential candidates are split on the subject. Bernie Sanders and Elizabeth Warren are arguing for, and Joe Biden, Pete Buttigieg, Amy Klobuchar arguing against, promoting as an alternative a public option. And just recently, a federal appeals court ruled that one of the pillars of Obamacare, the individual mandate, that you legally have to have health insurance, they say that's unconstitutional. So this could potentially kick another 17 million people off of healthcare. So lots to talk about with Dr. Woolhandler. That's in the first half of the show. In the second half of the show, we welcome back Dr. Bandy Lee. Dr. Lee was a guest a little over 2 years ago when she edited the book, The Dangerous Case of Donald Trump. 27 psychiatrists and mental health experts assess a president. Her Twitter profile states that she was, quote, uninvolved in politics until politics invaded her area of expertise, unquote. Apparently, President Trump's mental health has not improved over time. Prior to the impeachment vote in the House, Dr. Lee, along with 970 other health professionals, sent a letter to Congress warning of Trump's dangerous mental state arising from his brittle sense of self-worth. Guess it's like the old saying, if 970 mental health professionals tell you you're drunk, you better lie down. Dr. Lee does a psychiatric translation of many of Donald Trump's tweets and has also translated the recent rant he sent to Speaker Nancy Pelosi. It reveals what he's really saying. As always, somewhere in the middle, we'll take a short pause to check in with our corporate crime reporter, Russell Mokhiber. Got a big show today. So let's get to it with our first guest, who will give us the latest in the battle for single-payer healthcare. David?
Dr. Steffi Woolhandler is a practicing primary care physician, distinguished professor of public health and health policy in the City University of New York School of Public Health, an adjunct professor at Albert Einstein College of Medicine, and lecturer in medicine at Harvard Medical School. Dr. Woolhandler has authored more than 150 journal articles, reviews, chapters, and books on health policy. She is a co-founder of Physicians for a National Health Program, which is a nonprofit research and education organization that advocates for single-payer national health insurance. Welcome back to the Ralph Nader Radio Hour, Dr. Steffi Woolhandler.
Pleasure to be here.
Welcome back indeed, Steffi. I'm sure you've noticed that the discussion of single-payer full Medicare for all in Congress has been such that the advocates for single-payer seem to be on the defensive, that the defenders of Obamacare and the defenders of the current corrupt, discriminatory, expensive system seem to have corralled some of the advocates of single-payer into an economic argument over 10 years, 20 years, 30 years. But as you know better than most people, there are dozens of reasons to prefer single-payer, which have played out favorably in Canada. And you and Dr. Himmelstein did the first study when you were at Harvard Medical School that was peer-reviewed that said that 45,000 Americans die every year because they can't get diagnosed and treated in time because they can't afford health insurance. This was before Obamacare. The figure may be slightly less. How do you explain the lack of using all the arguments that are available against the present corrupt, deadly system and in favor of single payer by the promoters in Congress and elsewhere of single payer? It's just astonishing to me.
Well, there's been a huge influx of money into political advertising from the pharmaceutical and insurance industries. Over the summer, half of all political advertising in Iowa was paid for by this conservative group called the Partnership for America's Healthcare Future, really funded by the drug companies and the insurance industry. So half of all political advertising from this one entity. So we're facing some very rich corporate foes who are willing to spend as much as it takes to try to fool the American public and trick them into believing that Medicare for all is somehow a problem. We do know from other countries that have Medicare for all style systems that they spend half as much, that patients don't have copays or deductibles for covered services, and that patients have complete free choice of doctor and hospital. And many of these countries have longer life expectancy and better health statistics than we do. So the facts on the ground clearly favor a Medicare for all model, but it's just there's some very powerful corporate foes spending tens of millions of dollars misinforming the American people.
Well, as you know, the best bill in the House on single payer, which you and Dr. Himmelstein had a hand in drafting, is supported by over 120 Democrats in the House of Representatives. That's a lot of lawmakers. And the chief sponsor is Representative Jayapal of Washington State. Now, I was in the office of Representative Jayapal a few days ago, and I spoke with her chief of staff. He was a new chief of staff. However, I said, "Have you ever heard of Dr. John Gaiman?" And he said, "No." And as you know, Dr. John Gaiman, he's in his 80s now, a heroic figure in many ways, former professor of medicine, practicing family physician, has written a whole number of books on Obamacare, Trump care, and he's coming out one with all the terrible situation affecting long-term health care for elderly patients. And that's just an example that absolutely astonishes me. You have Bernie Sanders has a bill, which is not as good as the House bill, but he's for single payer. You have Elizabeth Warren, who's for single payer. And I don't know who her consultants are, but they really steered her into a serious trap with projecting $20-30 trillion. Of course, that is, even if that was the case for single payer, it's much cheaper than what the 20-30 year projection would have been for the present profiteering, corrupt, wasteful system. But she was thrown on the defensive. And for several weeks, if not continuing, her advisors are a professor from University of Pennsylvania, Emanuel. I think he's the brother of Rahm Emanuel, who was Clinton's advisor. Why don't they start this way? It saves more lives. It is more efficient. It reduces anxiety, dread, and fear, which is rife in this country. I'm talking about single payer. And it comes in at half price per capita on the average in Canada. Canada, the latest I checked, comes in at $5,000 per capita per patient. We're at $10,000 per capita per patient. In Canada, everybody's covered for that price. In the U.S., we have 29 million people not covered and another 50 million undercovered. Now, why can't these political candidates, why can't these lawmakers make all these arguments? I just put out something called 25 Ways the Canadian Healthcare System is Better Than Obamacare for the 2020 elections. People in Canada don't fear changing jobs because they might lose their health care, among one of many differences. Can you enlighten our serious listeners who have heard quite a bit about full Medicare for all on prior programs, why the protagonists allow themselves to be thrown on the defensive and don't make all the arguments?
Well, I certainly think Bernie has been very good at making an argument similar to what you're saying. He, even in like 90 seconds or 2 or 3 minutes, he's been able to make most of the points that you're making, that things are better in countries with single payer, they're cheaper, people live longer, there's less worry about health care. I think Elizabeth Warren has made some of those arguments. She did decide that she had to figure out a way to say she was doing this without raising taxes. I think that's a little bit silly. I think it's much more straightforward to do what Bernie did and say, yes, we're going to raise your taxes, but you're going to lower your premiums and you'll end up ahead. But she made a very elaborate transition plan to be able to avoid saying she's going to raise middle class taxes. But it's a political decision. I'm not a politician, but as a health policy expert, I can tell you that you need to have a simple system. You need to pass it and implement it right away, because implementing it over time means that you don't get any administrative savings and it becomes too expensive to actually get to the system you want. I mean, the beauty of the single payer system, you have to implement the whole thing, but once you implement it, you get huge savings on administration because it's very easy to implement insurance that's universal. You have a very low overhead of only about 2% versus in multi-payer systems, the overhead is usually about 12%. You make it possible for your hospitals to simplify their billing department, in fact, pretty much get rid of their billing department and just receive a lump sum budget the way any other service like a fire department would get a budget. You make things simpler for your doctors because they send all their bills one place. So that kind of administrative simplification in Canada saves them about at least $500 billion a year on just paperwork and bureaucracy costs, and you use that money to cover everyone. But if you do some sort of halfway measure, some sort of public option or half public, half private, you do not get those administrative savings, and you have to come up with the extra $500 billion a year in funding in order to cover everyone. So I'm definitely an advocate for going all the way to single payer immediately, because that's the only way you get the administrative savings that make it affordable.
How long do you think the transition period would be from single payer replacing the existing system?
Well, I think the best example, best experience we can use is the U.S. Medicare program. And it was signed into law by President Johnson, and it started paying doctors and hospitals 11 months later, having signed up 19 million senior citizens in less than 11 months. And this was in the era before computers. This was all done with postcards, okay, and pieces of paper. So it is not, from a technical point of view, you can implement a single-payer system within a year. So if we're just talking about the technical side of signing people up and arranging payment, that can be done in 11 months or a year, like the Medicare program was. So I think that's what the transition should be. The transition needs to be the amount of time it takes you to set the system up. You need to do some special efforts, for instance, for people who lose their jobs, because if you're saving $500 billion in administrative expenses, you're obviously cutting out a lot of administrative jobs. So you do want to set a big chunk of money aside for several years to help those people find new jobs, to support their income, to retrain them. You do want to do an orderly transition. The hospital budget is very high now, and you're planning on setting it lower. You need to do that gradually. You can't just go in and start cutting the budget. Even if it's a wasteful budget, you can't cut every penny of it right away. But I do think, within a couple of years, you ought to be able to complete the entire transition. And frankly, within the first year, you ought to be able to transition the payment system completely.
We're talking with Dr. Steffi Woolhandler, who was one of the pioneers in documenting the superiority of a single-payer system and all the horrific administrative costs, personal vulnerabilities, human casualties of the present system. I have a lot of cousins in Canada, and I was lead author of a book called Canada First years ago, and they don't even see a bill for the most part when they go. They have their Medicard, they go for an orthopedic operation, and then they have rehabilitation, and they don't see a bill. In our country, because of the system, the bills are sheet after sheet of computerized code or inscrutable inserts. And as a result, unlike in Canada, we have, according to Professor Malcolm Sparrow at Harvard, an applied mathematician who's been on this show, and a 1992 congressional report, right this year, a minimum of $350 billion in computerized fraud, billing fraud, $350 billion with a B. That's almost
Yeah.
half the military budget. Steffi, I have not heard a single candidate who is supportive of single payer make that point.
Well, okay, the billing fraud within the current healthcare system, I can speak a little bit to that. One of the things you want to do with a single payer system is switch a hospital to lump sum budgeting. So instead of having a hospital bill for each patient, you decide the budget the hospital needs in negotiations, and then 1/12 of that budget is placed into the hospital's bank account every month. There's nothing strange about that. That's the way a fire department in the United States would negotiate and receive a budget. That's the way a public school negotiates and receives the budget. But you could do that for hospitals as well, which is exactly what they do in Canada. And what that means is you can't do billing fraud. I guess perhaps there's ways people can be crooks or something, but because you're just giving the hospital a budget and then auditing it, you minimize the fraud potential through that global budget. In terms of physicians, if physicians have to send all their bills to the single payer, then the single payer knows exactly what you billed for. And if you're billing for more hours of patient care than there are hours in the day, the single payer knows about it. If you're billing for 2-year analyses when every patient comes through your door, the single payer knows about it because it has all the information right there. So I think, in fact, monitoring for fraud becomes much easier in a single payer system, and there would probably be some additional savings on that. I think that money you save on billing fraud is money that you ought to save that money and transfer it to the care that patients need and are not getting today.
What do you think of the medical profession here? They opposed Medicare in the 1960s, but they have become more and more dependent on the big health insurance companies, the drug companies, the corporate establishment. It's lost much of its independence, the medical profession. You think they're going to become more aggressive? The polls show a narrow majority of doctors want single payer because they want to practice medicine, not bookkeeping, and they don't want to be harassed. And a larger number of nurses want it. But do you see us ever getting a single payer without a much stronger involvement by your profession?
Well, I think you're right that the profession is changing in terms of its views. It's become much more liberal on healthcare financing issues, and I think you're right. It's about 50-50, with 50% or more of doctors saying they would be okay with a single payer system. There's obviously some doctors who are the real entrepreneurs, are very high rolling and making millions of dollars. Those people are not very happy with the idea of single payer because it would cut into their incomes. However, for the average doctor who makes her living seeing patients, in fact, the incomes would be fairly stable if we transition to single payer, and the doctors would have more of their time and resources to spend on patient care and be wasting less of their time and resources on administration. So certainly the polls are supporting what you're saying, that the medical profession has shifted its views, with a slight majority now favoring single payer. That's good news in terms of implementing single payer, because it's pretty hard to reform a healthcare system if your entire medical profession is lined up against you. But in general, doctors in countries that have succeeded in getting to universal health care seem to be doing pretty well. The doctors in Canada are not, I'm sure they have their complaints, but by and large, they're well paid. They're happy with their work. If they want, they could immigrate to the United States. Very few of them do. In fact, more U.S. doctors are going the other way these days. So, I think the doctors have moved on this issue, and the work that our organization, Physicians for a National Health Program, does is to keep getting them moving even farther and faster into the single payer camp.
But the biggest outstanding argument, Stephie, is 160 million people already have health care and they're very pleased with it. You want to take it away from them? Can you respond to that?
Yeah, well, I think if you look at the polls closely, you find that people are saying they like their doctor or they like their hospital. They're not saying they like their own private insurance company. What they really care about is having coverage that allows them to make a choice of their doctor or hospital or other practitioner if they want to see another practitioner. And, but the insurance industry loves to confuse people and poses that question to people in a way that makes them think that what they're really talking about is choice of doctor and hospital. So, choice of doctor and hospital is what people care about. Choice of insurance, they really don't care. And I think that's what the polls say.
And also, if you've never had to file a claim, you're happy with your health plan. But when you file a claim and you see how often it's denied, I think the Nurses Association California put out a study a few years ago where 1/3 of the medically recommended procedures were denied by the major health insurance companies in California. But, it's a puzzling problem. President Truman recommended universal health care over 60 years ago, and we're still grappling with this situation. What about the big corporations? They don't really like to have to pay health insurance. They don't like to have to, through intermediaries, bicker with their employees about coverage. Why aren't they more of a lobby? Because in Canada, it's a competitive advantage for General Motors of Canada not to have to pay health insurance compared to General Motors in the U.S., which pays more for health insurance than it does for steel and manufacturing its products. So why aren't they coming forward and becoming a lobby on Capitol Hill?
Well, you're absolutely right that the lower total cost of healthcare in Canada represents a comparative advantage for Canadian manufacturing, which has not contracted as rapidly as manufacturing in the United States, basically because the healthcare costs mean that production costs are lower in Canada, despite good wages. Canadians get pretty good wages, but the healthcare costs are so much lower. I think the business community is aware of the fact that if you don't pay for healthcare out of wages or as part of the compensation of workers, you will have to pay for it as a tax. That's just true. You do have to pay for it somewhere. And they're aware of the fact that they would likely be the ones paying the tax. So I'm not sure they're convinced that they would be paying a lot less, at least in the short run. I think over the long run, as our healthcare costs started to come down and approached the lower levels that we see in Canada, they would start to save money. But it doesn't seem that likely that the first year or two they would save money because their taxes would go up to recapture the money that they're now spending on health benefits.
What about the daily hassle with employees needing medical care? And it's almost always a prominent factor in the acrimony during labor union negotiations with these corporations. Don't they take all that into account, that they can be relieved of that?
Well, certainly a lot of contract negotiations center around healthcare costs, because with healthcare costs going up year upon year, there's a big acrimony about who's supposed to pay for that extra 4 or 5 or 7 or 8%. So it would really improve labor management relations if healthcare costs were stable and only went up with inflation and didn't keep exceeding inflation. That would be off the table in terms of negotiations, and from a union's perspective, might make it a little easier for the unions to win other benefits or wage increases. But, I think the simple answer is it's actually better for everyone if you can have a system that's both higher quality and cheaper, which is what you can get with a single payer system. And we know you can get it because we've seen they've gotten that in Canada.
Well, the crisis is coming. It is a crisis now, obviously, an economic crisis, a human crisis. When Medicare was passed in the 1960s, the share of the gross national product devoted to healthcare expenditures was about 3%. And now it's about 18%. And probably in 30 years, it will cross 26, 27% of all expenditure in our entire economy. When will the rubber band snap in terms of getting Congress to go with all other Western democracies with a single payer system?
Well, we certainly are trying to make that snap as soon as possible. I think there's the economic costs that you're talking about at the national level, but there's always also these huge economic costs that families pay as out-of-pocket costs or premiums and these huge health costs that we pay, which is Americans not getting care and being sicker and dying younger as a result. So I think we need to be pushing as advocates, as a political movement, me as a physician, we need to be pushing to get the system fixed so that people can get the health care they need and doctors can actually focus on getting patients well and not on finances.
Well, Warren Buffett, who's worth about $60 billion, once said that it's a pretty rational system to have full Medicare for all, free choice of doctor and hospital. He knows economies when he sees them. And he also knows what the situation is in Canada and other countries where he has investments. The head of General Motors in Canada, Jack Smith, when he became head of General Motors worldwide, situated in Detroit, said, yeah, it works pretty well in Canada. But I think the restraint on big business is that they don't want to take another big business to the woodshed. I mean, if the big corporations took on the health insurance giants and the drug giants, they would be arguing for displacing the health insurance corporations and limiting the greed and profits of the drug companies. And they're just not willing to engage in that kind of seismic collision publicly because they fear that it could come back to haunt them in terms of some kind of retaliation. So there's a kind of silent concordat between big business that I've seen over the years. Dr. Woolhandler, can you give our listeners the website for Physicians for a National Health Program, where they really get a lot of good information? They can see there are thousands of physicians who belong to this supporting single payer.
Sure. You can just Google Physicians for a National Health Program. Our initials are PNHP. So that would be the World Wide Web, pnhp.org. On Twitter, we're at PNHP. But go online and educate yourself about it and join us in really getting this work done to move our country to a reform that we need, that single payer reform.
Listeners, get involved on this because there's no way we can escape this problem other than to succumb to it with all its pain, misery, and economic oppression. We have to face up to it. We're the majority. We can turn Congress around. Why don't we get more functionally indignant and informed and start doing it in the coming election year? Stephie, is there anything else you'd like to tell our listeners before we close?
No, I would agree. Now is the time to get involved. There's a lot of discussion about this around the presidential primaries, and you can write letters to the editor. You can attend community meetings. You can educate yourself, but you'll find that there's a lot of interest in the issue right now everywhere, and it's a very good time to get involved.
Thank you very much, Stephie, and to be continued. You've pioneered with Dr. Himmelstein with those great articles in the New England Journal of Medicine, documenting the waste and harm and repression of the current system and highlighting what single-payer systems in Canada and other countries can do if we were smart enough to emulate them and even improve on their record. Thank you very much, Stephie.
Okay, my pleasure.
We've been speaking with Dr. Steffi Woolhandler. We will link to her work at ralphnaderradiohour.com. We're going to take a short break. When we come back, we're going to talk to Dr. Bandy X about the current state of Donald Trump's psyche. But first, let's find out what's going on in the corporate crime underworld with our corporate crime reporter, Russell Mokhiber.
From the National Press Building in Washington, D.C., this is your Corporate Crime Reporter Morning Minute for Thursday, December 26, 2019. I'm Russell Mokhiber. After Prime Minister Justin Trudeau's failed efforts to see SNC-Lavalin avoid prosecution led to him losing two key ministries, his edge in the polls, and almost his party's hold on the government, the Quebec engineering firm at the center of the controversy walked away with a plea deal that looks a lot like what it asked the government for in the first place. That's according to a report from the CBC. A judge last week accepted the plea deal that a division of SNC-Lavalin Group struck with the Office of the Director of Public Prosecutions. Under the agreement, the company pled guilty to one charge of fraud over $5,000 in relation to the company's activities in Libya. All other charges have been dropped. We are happy. The company is happy, said SNC-Lavalin lawyer Francois Fontaine. For the Corporate Crime Reporter, I'm Russell Mokhiber.
Thank you, Russell. You know, in some ways, Donald Trump is an open book. He appears to be almost completely unfiltered. His tweeting and his speaking at rallies, as well as the recent letter he sent to House Speaker Nancy Pelosi, provides us with a unique glimpse into his thinking, almost hour by hour. With the impeachment now a reality and a Senate trial looming, Donald Trump is under increased pressure, concerned not only with his upcoming reelection, but with his legacy. Despite the bravado, how does he really seem to be dealing with it? And what does that mean for the rest of us? Our next guest has some answers. David?
Dr. Bandy Lee is a forensic psychiatrist on the faculty of Yale School of Medicine. Dr. Lee edited the book, The Dangerous Case of Donald Trump, 27 Psychiatrists and Mental Health Experts Assess a President. Prior to the impeachment vote in the House, she, along with 970 other health professionals, sent a letter to Congress members warning of Trump's dangerous mental state arising from his brittle sense of self-worth. Dr. Lee also did a psychological translation of President Trump's recent letter to House Speaker Nancy Pelosi. Welcome back to the Ralph Nader Radio Hour, Dr. Bandy Lee.
Hi, thank you for having me.
Welcome back, Bandy. We've just put out, Mark Green and I, a book called Fake President on
I saw that.
On Donald J. Trump. And it has a lot of his quotations and his statements, which really, when you put some of them, you don't have to put all of them together, lead us to conclude that he is a very unstable egomaniac. I mean, he said things like, only I could fix it, and I am a stable genius, and I know more about war than the generals, and I know more about taxes than the tax experts, and I know more about this and that. I mean, this is a president speaking, some upstart entrepreneur full of vainglorious ideas. And of course, he has expressed publicly admiration for dictators, and he names them. And he said, I wish I had that kind of power in the White House. And then he makes the classic statement that will be indelible through history, which I wish the Democrats stated more on the floor when they impeached him. Here's what he said. From Article 2, I can do whatever I want as president, end quote. Really? Has he read Article 2? Has he read Article 1 in terms of the most power being put in the hands of the Congress? So now you've looked at it from a perspective of social psychology and psychiatry. What do you make of him today, before we get into the analysis that hundreds of people in your specialty have made of his 6-page rambling letter to Nancy Pelosi?
Well, first of all, I take responsibility for all my views. My views are my own. In my book, I already state that there are reasons that the population was attracted to a president who with such faulty characteristics as you outline. And for decades, I had been concerned about the state of our collective mental health, public mental health. And so the fact that there were enough voters, even if he lost by 3 million of the popular vote, he still had enough to win this presidency. And that's very telling of our society. And so I'm actually looking forward to reading your book. I read your open letter, don't have the book yet, but your letter already states that a fake president is someone who is unfit to fulfill the duties of the office due to a lack of stability, integrity, honesty, and knowledge. And I have actually often said that Donald Trump is like a captain at the wheel of a ship whose mind is actually really not there, who's asleep at the wheel. And it's very dangerous because many people may look at him and he appears as if he is functioning, but in fact, the mental capacity is not there. And so you will have done an analysis from your perspective. We've actually done an analysis from our perspective based on, intimate coworker reports of interacting with him under sworn testimony. It's the best kind of data you could get in the Mueller report. And he failed every criterion of mental capacity. So imagine that we have someone who doesn't have the capacity for almost any job is actually holding the highest office in the country.
Well, there's overwhelming evidence in the following realms. Number one, he doesn't read. He can't stand briefings more than just a minute or two. by his advisors. He spends almost all his time watching cable TV and tweeting. He's now tweeting recently at the rate of 100 a day. And how much time does he have to preside over the agencies and departments of government and the corrupt henchmen that he's put in the area of regulatory health and safety? The answer is virtually nothing. That, by the way, is a violation of our Constitution. There's a duty in the Constitution that the president has to preside and supervise his nominees, his appointments, his cabinet secretaries, his agency heads. So that's one. He's just clueless there and has no interest. He's like an AWOL president in the Oval Office. The second is he's clocked at over 14,000 lies and fabrications by the Washington Post and others. And when you lie about serious matters of state, when you say, I have made the water cleaner, I have made the air cleaner, I have brought more manufacturing jobs than my predecessor, I have produced tax cuts for the mass of the Americans instead of overwhelmingly for the rich. When he talks about these things, they create a fantasy world. And so he is removed from reason, logic, facts. And the voters who believe in him, he is separating them from reality, which can be very, very uncomfortable for those voters. When you live in an unreal world because you believe the leader, it's a very serious problem, not just for Donald Trump. There is a social psychiatric problem.
Yes.
The country is always, throughout history, all people live by myths, they live by fabrications of their leaders, or they live by refutation of these fabrications, or they live by the truth and by logic and reason. So he's affecting millions of people. And I just want to end this comment by replaying a quote I heard by an Ohio worker. He was a blue-collar worker, 52 years old. He moved from Ohio to Georgia, and he was asked by a reporter about his views on Trump. And here's what he said, and I'd like you to analyze that. He said, they all say that Trump is crazy, but he's saying what I'm thinking. Does that mean I'm crazy? Your reaction?
A lot of what he's saying is actually his sensing of others' fears, others' wishes, fantasy thinking, and conspiracy theories. In fact, when someone is cognitively compromised or compromised in their higher functioning, we tend to think that they will simply be debilitated, but that's actually not true. The mind is of many layers, and when the higher functions are compromised, the lower functions actually increase in their power. These we call the primitive brain or the primitive impulses. And his primitive desire to be the king of everything, best in everything, and admired by everyone, allows him that emotional drive to have that status, drives him to sensing the primitive thoughts in other people far more effectively than any conscious mind or strategy could. So it's very dangerous indeed, because he will be echoing those thoughts, and people would mistake that as being empathy or understanding other people. He is not doing it to understand other people. He is doing it for his own purposes, for overpowering them, for using them, deceiving and manipulating them, and preying upon them. And so those skills are increased in an impaired individual. That's why an element of pathology is far more dangerous than someone simply being evil and ill in intent.
What's your take on his nicknames? He's insulting people right and left by name, sometimes people who nobody's heard of that come across to his attention. He has this penchant for constantly insulting people, lying Ted Cruz, little Marco Rubio, crooked Hillary. And he incites his audience at these big rallies to say, lock him up, lock her up. What is his need constantly to?
Well, it comes from denial and projection. He's actually talking about himself. Whenever he names other people derogatory names, he's actually denying that these qualities belong to him. It's all an unconscious process. So if he calls someone else those things before he gets called out, it feels like he is immunizing himself a little. And for people who are unarmed, it works. So he is projecting qualities he's trying to deny in himself onto other people that he wishes to target. And
well, why don't his adversaries give him his own medicine by giving him nicknames? Dangerous Donald, Decadent Donald, Draft Dodging Donald, Dumb Donald.
Right.
Why did they hesitate? Because that would
because we don't wish to stoop to his level, but you're right, we need to point it out. And if people were consulting us psychological professionals, that's exactly what we would tell them, that we would throw some of that reflection back on him, and that would disarm him and make him incapable of doing more of that. But instead, people in polite society treating him like a normal person when he's severely impaired, have responded the way we would to normal people, with politeness, with courtesy, and people are completely at a loss as to how to handle someone like this.
That's one thing on a personal basis, Bandy, but when the mass media replays all these insults and they don't give the victims of his insults any chance to reply, including media like the New York Times and Post, not just, Fox News or whatever, it's very unfair. And they don't seem to know how to neutralize his insults by giving him his own medicine.
The normal course is to play into the hands of pathology and to help it. So not only did people not point this out, they have actively done things that would help him along and make it worse. So the press coverage, other people's responses have definitely made it all worse.
And the other side of his personality is unctuous flattery. Everything is fabulous, is great, you're the best, you're superior, you're great, you're brilliant. What does that signify to you? Massive flattery on one side, massive insults on the other.
Well, he's usually flattering himself, and he's puffing himself up with a grandiose facade because he feels that's a reaction against his inner feelings of inadequacy and worthlessness. I mean, he is unable to go for a few days, it seems, without credible, unreal levels of adulation. That's why he needs to run rallies once in a while and have everyone around him flatter him in ways that we've never seen in the cabinet or elsewhere.
Now, some of our listeners may be saying, and we're talking with Dr. Bandy Lee, Yale University, some people might say, this is penny psychiatry. This is nonsense. You should never render any kind of psychological profiling on someone you haven't personally interviewed. A lot of psychiatrists believe that.
I believe that as well.
Okay, why? Explain that.
Yes, I believe it's wrong to diagnose someone like your patient when you're not seeing them as your patient, and a public figure is never our patient. But it is correct to share our knowledge for the sake of public good, to help protect public health and safety, and especially when a public figure who is not our patient is dangerous to the public, then we actually have a duty to inform and educate, warn, and protect the public. I mean, this is one part of our double responsibility, our responsibility to patients and responsibility to society. So this counts as our public health duty. So the reason why people are conflating the two is because the American Psychiatric Association itself has acted in a very unprecedented and aggressive way to reinterpret its ethical guidelines shortly after Trump's inauguration. This was back in 2017 when they changed the Goldwater rule, which is actually a very reasonable rule. It means that we have to meet our responsibility to society by improving the community and bettering public health. And the way to do it is when we're asked about a public figure, we educate the public in general terms, just don't diagnose. But they reinterpreted that, instituted a new absolute prohibition in that we cannot say anything about a public figure at all. And that actually forces us to violate every principle of medical ethics and also the Universal Declaration of Geneva. All health professionals take the Universal Pledge by the World Medical Association, that's the Declaration of Geneva, which mandates us to speak up when there's a destructive regime. This came right out of the experience of Nazism. It was instituted in 1948. And this one American psychiatric association, one among many, and this rule doesn't apply to non-members because it can't be admitted to any state licensing agency board because it violates the First Amendment. And to elevate our courtesy, it's really just a courtesy to a public figure above our responsibility and duty to the public and to all our other medical responsibilities is really egregious. And I would actually like to note this as the real issue of democracy, because the First Amendment was established for citizens to be able to speak up against the tyrant. And who would be best able to detect the personality disorders of a potential tyrant than mental health professionals? And by gagging us, totally silencing us, they have changed the public discussion in ways that I believe changed the entire course of our ability to manage this presidency. And I think you would understand this better than anyone because you have noted the need for social psychiatry and applying the principles of psychiatry to society. Well, we already have that. We already have public mental health. And I myself, having trained in anthropology, am a social psychiatrist of sorts. And I also work with criminal justice and the legal field as a forensic psychiatrist. And so there are many tools we could have used.
Let's get to the 6-page letter that President
Yes.
Trump sent to Nancy Pelosi just before the impeachment debate and vote. And you took the lead here. You said no healthy human being, not even a Republican who loves Donald Trump, can read his letter to Nancy Pelosi and feel comfortable. The letter is a very obvious demonstration of a troubled state of mind. And you got 800 mental health professionals to sign a petition asking the House Judiciary Committee to consider mental health aspects. What troubled you about this 6-page letter?
It wasn't because of the 6-page letter that we put in the petition. The petition went in actually when the Judiciary Committee was having its hearings before their vote. And so already that many mental health professionals signed our petition of concern that as impeachment proceeds, that the president will become more dangerous than ever and rapidly so. And the letter actually is a sign of that. As you noted, the frantic tweeting, the increasingly unrealistic rallies where he is disconnected from reality, and the 6-page letter that states almost every situation in the opposite of reality. And it's a pretty severe manifestation. So I went ahead and interpreted the letter. In fact, I call these quote-unquote translations because once you know the dynamics of how he functions, and we have plenty of information, as you said, he's one of the most transparent presidents in history. And when we bring a psychoanalytic lens to it, we can figure out his defense mechanisms, the things the way he denies things or projects things, and how he turns around reality, sometimes to delusional levels, because he has such severe narcissistic pathology and an inability to accept reality the way it is, that he has to fabricate an alternative reality. And that's what he's doing with the letter. And he made it an open public letter so that others will read it and adopt his pathology. In fact, this pathology can be contagious. It spreads, and we call it shared psychosis. That's also something I write about in the op-ed.
Explain shared psychosis, because he's surrounded by people who have to be sycophants. They can try to restrain him, edit some of his tweets, but they have to be sycophants. You're saying this is a contagion that goes beyond the White House, beyond the executive branch, and throughout the country, and millions of people?
Yes,
part of it?
indeed. That's exactly what I am trying to say. And you said sycophant. Has it ever struck you as a bit unusual that merely sycophantic individuals, highly intelligent and accomplished and otherwise sane human beings, would be as sycophantic as they are? That usually happens when you have a truly paranoid or delusional leader. And when their level of impairment is of a degree, it's really a matter of degree. If it is of a degree that is severe and pathological, then there is a phenomenon that happens that is called shared psychosis. It's a contagion of these delusions or other symptoms onto individuals who are otherwise healthy. It's actually a very dramatic phenomenon when it happens in households. Rather than the healthy members of the family making the sick member well, it's the other way around. The healthy members take on symptoms of the sick individual. This is when the sick person goes untreated. And it's rather quite graphic in how it happens. But just as quickly, when you remove the sick individual from the household, the other members grow better, sometimes within days. So you usually hospitalize the person and treat the person and educate the family, and then they can re-enter the family and everything will be fine. But that's just the power of mental pathology, how it can just override rational thinking and simply through the sheer emotional force of it make healthy individuals look psychotic.
Let me interject here a moment. We're talking with Dr. Bandy Lee of Yale University. The media is uncomfortable with psychiatrists and social psychologists talking about the president in this way. You don't get as much media play as many people think you should. But I think
there's an active silencing.
I think Donald Trump has put his mental health in play because he talks about other people and labels them crazy. Crazy Nancy Pelosi, crazy Bernie Sanders. He always uses the word crazy. So, he's lost any kind of cachet, any kind of adhering to the taboo that you don't evaluate a president in that way.
You don't use mental health terms as insults, but when actual professionals use them, they are not insults. They are descriptions of actual medical conditions. And we have professional standards. Medical neutrality is one of them, and neutrality means that you do not change the standards of your assessment depending on the situation or political convenience. And unfortunately, we have a very severe situation where simply, silencing the messenger does not make the situation go away. And that's partly why, as uncomfortable as it is, believe me, it gives me no pleasure to point out what's happening. But I feel a duty to point out what's happening exactly as it is and not downplaying it.
Are you getting a lot of pushback from the public and from your colleagues around the country? And are you getting a lot of support?
I'm actually getting tremendous support from the public and from my colleagues. What is inhibiting us is the leadership of the American Psychiatric Association. As I said before, they have gone to extreme extents to distort ethics and to play upon public misconceptions, like stating what we're doing as diagnosing, for example, when it has nothing to do with diagnosing. And I've actually drawn an analogy between them and the Attorney General, who is actually using the Department of Justice and the law to support power rather than support the law. So this is happening in multiple domains, in the power structures. And the media are more afraid than actively silencing us, I believe. I've been invited more than 50 different times on cable news programs and network news, some of them prime time. 100% of them have been canceled. And a reporter based in Washington said, this looks more like there's a memo that the producers want us and they're constantly looking for us, but then someone high up cuts us off because it's inconvenient, or maybe they're afraid that they might be attacked by the president. We know that whistleblowers and informants are vastly less likely to speak up now because of the president's threats, and the same is happening with mental health professionals.
Has Trump or his high-level associates responded to you, tweeted about what you're writing?
No, they've been largely silent, but Congress members have been contacting us since the very start. Many Congress members have contacted us, and I've spoken with up to 50 in the end, but they encourage us to continue educating the public so that they can do what they, from their end, what is needed to protect the country. But obviously, after a petition that's been signed by more than 970 professionals in the end, did not enable the Congress to be able to consult with us.
How about overseas in other countries? Are they more responsive to your writings?
Well, actually, our coalition of mental health professionals, we formed a coalition when hundreds and later thousands of mental health professionals got in touch with me from around the country. But we got so many responses from overseas mental health professionals that we actually turned our national coalition into a world coalition. And so it's a world mental health coalition now with over 4,000 members in total and from all around the world. 4 different continents, I believe.
We've been talking with Dr. Bandy Lee from Yale University, who's written a great deal of articles on what is often a taboo subject. What's the mental health state of our president? And I might say that he's not the only president who was in a dubious mental health state. And we better, as voters, raise our expectation levels and be much more demanding about the personality, character, and integrity of our leaders, not just in the White House, but in high political office and executive suite of giant corporations. Thank you very much, Dr. Lee.
Thank you very much.
We've been speaking with Dr. Bandy Lee. We will link to her work at ralphnaderradiohour.com. I want to thank our guests again, Dr. Steffi Woolhandler and Dr. Bandy Lee. For those of you listening on the radio, that's our show. For you podcast listeners, stay tuned for some bonus material we call the Wrap-Up. A transcript of this show will appear on the Ralph Nader Radio Hour website soon after the episode is posted.
Subscribe to us on our Ralph Nader Radio Hour YouTube channel. And for Ralph's weekly column, it's free. Go to nader.org. For more from Russell Mokhiber, go to corporatecrimereporter.com.
And Ralph's got 2 new books out, The Fable, How the Rats Reformed the Congress. To acquire a copy of that, go to ratsreformcongress.org. And To the Ramparts, How Bush and Obama Paved the Way for the Trump Presidency and Why It Isn't Too Late to Reverse Course. And of course, I should have said 3 books because it's also Fake President, which we referred to in this show, which he wrote with Mark Green. We will link to that also.
Join us next week on the Ralph Nader Radio Hour. Thank you, Ralph.
Thank you, everybody. Have a good holiday season, and let's hope for a more productive and just new year.
Hi, this is Jimmy Leewert, producer of the Ralph Nader Radio Hour, and welcome to the Wrap-Up. First, we speak a little more with Dr. Steffi Woolhandler about single-payer health care.
You know, I don't see us getting single payer without changing Congress. We need organization in every congressional district. I've said again and again, and there really are very few of those focused on full Medicare for all, free choice of doctor and hospital, better outcomes, and much less expensive, and much less anxiety, dread, and fear, to try to summarize it in a soundbite. When the drug companies lobby Congress, they usually have one lobbyist for every member of Congress. When they got the drug benefit through without allowing the U.S. government to negotiate drug prices back about 15, 20 years ago, we counted 455 full-time lobbyists. These are people who go up on Capitol Hill and go down the corridors and go in the office. That's not to count all the other lobbyists around the country from Merck and Pfizer and all these other drug companies working it from back home. I don't see it happening unless we have several hundred lobbyists, including people from the medical profession, economists, public relations people, lawyers, who really go up to Capitol Hill every day and start turning these people around, one after the other. About 1/3 of the Congress, by my count, would vote for single payer. But I think if Warren Buffett put $2 billion into a lobbying effort, organizing groups in every congressional district, representing majority opinion, majority of the people now want full Medicare for all with free choice of doctor and hospital. None of these crazy, cruel networks. and reasonable price controls on drugs. And I think in 36 months, regardless of who's in Congress, we would get full Medicare for all. And we would, in effect, displace a huge wasteful system that now runs at $3.5 trillion, listeners, a year. $3.5 trillion a year. Now, I'm always looking, Stephie, for an enlightened billionaire who wants to go down as one of the greatest figures in American history. Do you have any suggestions?
Well, I don't run into many billionaires in my daily life, but if I do,
you have to go to the wine cave.
I would have to tell them that, this is something that would really improve the situation for the American people and for my patients, but for the millions of people out there who need health care and, really can't afford it and have to decide, well, am I going to go to the doctor or am I going to buy school shoes for the kids? So I think we really need a situation where health care is a human right and we provide it. And we do know that there's models for doing this that have been used in other countries that work very, very well.
It's a pay or die system in so many ways, certainly in the drug industry. It's a pay or die system. Or if you have to have a major operation and the health insurance is not there or it doesn't cover the full scope of it, it's a pay or die system. But, I think it all comes down to this, Stephie. The majority of the people want it. If there's more publicity about how their lives would be so much better in so many ways, labor mobility, less anxiety and dread, less worry about their kids dying or getting sick. It all comes down to how many full-time lobbyists are working on Congress in Washington and back home. And right now, I don't count 10. I don't count 10 full-time lobbyists. I go to Congress all the time and bump into the hospital lobby and the drug lobby and you name it, the AMA lobby. I don't bump into full-time lobbyists. The AFL-CIO, their members have health insurance, and they're not that keen on using their political capital for the 80 million people who are underinsured or have no insurance at all. So that's what it really comes down to. Several hundred full-time lobbyists back home, 100 or 2 every day on Congress. You'll go from 130 to a veto-proof majority. There's no argument against it that can stand the test of human rights, humanity, safety, health, economic efficiency, and a respect for posterity. Because if we hand a $6 trillion annual bill to our children and grandchildren, the consequences are going to be horrific. And I think more people will just quit the country and go to Canada and other countries just on that health insurance liberation alone. So that's where David, Steve, any comments for Dr. Woolhandler?
Yeah, Dr. Woolhandler, as a physician, what was your aha moment? When did you come to realize that this was the path to go, single payer? Or did you always feel this way even in medical school? What was it about your personal experience that put you on this course?
Well, I've always been a supporter of universal access to health care. And really, when I started to thinking about medical school, that's what I wanted to do, is to work to get everybody access to medical care. I actually ended up teaching in a public health school early in my career. And again, I'm teaching now, but early on, I started looking at comparing health systems in different developed nations. And the closer you look at countries like Canada with national health insurance, the better you realize that that's the way to go, that there's real models out there that are in place, that are working. Not perfect, but they're working so much better than what we have here. So after teaching the course for a couple of years, I went back to clinical work, seeing patients, and founded Physicians for a National Health Program, which advocated for a Canadian-style model. And believe it or not, at the time, this was, 30 years ago or so, the Canadian model was not very well known in the United States. And we've worked over the decades of making that model much better known. The thing that makes it a little easier than you might think is that there's many Canadian doctors who, in fact, are members of the professional organizations in the United States. There's a lot of people who go back and forth and practice in Canada or practice in the U.S. because the credential works both places. So that was extremely helpful in terms of working with the medical profession and persuading them that things are really okay in Canada, that a single-payer system is really all right for the doctors and much, much better for the patients.
And now we have an extended conversation with Dr. Bandy Lee.
Dr. Lee, what do you make of his affinity for dictators around the world? He envies them,
Yes.
he praises them, he covers for them, and he even alienates some of the traditional allies that we have in Western Europe. What's your take on that?
Well, he is a tyrant wannabe himself. And of course he would be drawn to those who work the same way as he does, have the same desires, and are actually more effective at realizing their desires. It's a complex psychological attraction that works like lock and key. Former CIA profiler Dr. Gerald Post recently wrote a book about that, and he wrote a chapter for our book, The Dangerous Case of Donald Trump, in that Trump and his followers have a psychological structure that they yearn for each other and they fit each other like lock and key. It's actually, most of the time when we think of tyrants or strongmen, we think of them as authority figures, but it's actually a very submissive personality type where you are looking for an ideal figure who will satisfy your needs, for someone who will take charge and someone you can follow. It comes from the lack of proper parenting. But when you're put in that position, like Donald Trump has been, you puff yourself up and claim that you are that figure, the stable genius who is an expert in everything, and only I can take care of all the problems. And then people in their wounded yearning for this type of figure are immediately attracted to such a person in ways that it would never work for a normal person. Normal people don't so yearn desperately for a strong leader that they don't see through someone who's saying, I alone can fix it. That actually means I'm being deceptive in some way, because no person who is capable of fixing things would say that. But those who are wounded and unable because of their yearnings and their fears and other psychological mechanisms can't see that, are actually attracted to these figures.
How about this for a silver lining for Donald Trump's narcissism and ego? Everybody knows he wants to dominate the news cycle 24/7. I mean, he gets up in the middle of the night and tweets in order to distract attention from something that might be in the news unfavorable to him. He wants to dominate the news cycle. He doesn't like to get involved in details. He doesn't like to engage anything that might take attention from him. So doesn't that argue that he is less likely to initiate a war like the, quote, traditional George W. Bush and Dick Cheney did in their criminal war in Iraq and elsewhere? That if he did, he would lose control of the news cycle. He would lose control of the focus on him. And you have to get involved in quagmires and details that he doesn't like to do. So while he's continued Obama's drone attacks and his special forces adventures in various countries, his very personality, his ego, would not lead him to get us involved into a major war. Your take?
Well, that's still thinking rationally. His psychological structure would not be that way. In fact, look at what he almost did in Iran in the middle of June when he ordered an attack. He quickly stepped back, but also look at what happened to the Kurds, how he unleashed Turkish forces on our allies and easily gave away dominance over the region to our enemies. So his reasoning will be, yes, it will be more on the side of non-action as far as he can afford it. Most violent individuals are actually cowards. They're usually fearful. And so most of the time it looks like that fear will deter. And also, as long as he's able to appear like the peace-promoting person, and there's great longing in the population for peace. But once people see through him and he's no longer able to attain adulation through these means, of course he will go straight to aggressive tactics. And his negative attention is far better than no attention. So even if he were to be dubbed the villain for causing a war or the most atrocious, well, if he can't be the best and expert in everything, he would rather be the greatest villain in history. So No action can be considered too outlandish in terms of possibilities for this president.
Do you think the dictator of North Korea is more stable personality than Donald Trump as they interact with each other?
I haven't studied him enough, but the two are very similar. The two show extremely similar traits. In fact, they seem to be of the same structure, and that explains the love fest that they have been having, but it can also explain the very precarious and speedy, without warning, launch of war against each other, which seems to be starting.
Let me suggest something else, just to try to see more granularly. He almost never smiles. In fact, if you took 1,000 pictures in the news of Donald Trump, not more than 2 or 3 would have him smile, for example, at an egg roll at the White House with kids. The second, he almost never appears with Barron, his 13-year-old son. In fact, he referred to Barron as Melania's son. Do you read anything in those two characteristics?
Well, these are complex questions. But first of all, he never smiles. Yes, you're right. What we see are smirks, usually, not smiles. Well, he's a miserable human being. Most of the pleasure he attains is actually from cruelty against others, and that cruelty is a well-recognized cruelty. It usually happens with sadistic individuals because they are envious of other human beings. They lack basic human qualities, and so they sense that lack, and so they will go after pretty much any human being. Tormenting them, sometimes destroying them, gives them pleasure because they have qualities that they lack. In terms of his relationship with Barron, well, he's lacking many of those intimate human emotions. He doesn't have empathy or a conscience, and so relating to other people requires, or pleasure from relating to other people, requires some empathy. He either sees everyone as an extension of himself, and either you work for him or you don't, you bring him benefits or you don't, and that's how he uses you, and rather than deriving pleasure from relating to you. So unless they're able to be of service to him, there's no reason for him to interact with anyone. And Barron, being a child, is of very little use.
You know, I'm a little troubled by all this because I think that George W. Bush and Dick Cheney behaved in an insane manner. I mean, they blew apart a country that never threatened them. They toppled Saddam Hussein, who was often an ally of the U.S. when he was going after local communists, and got a lot of aid. And then they continued to destroy that country. They blew up its infrastructure, its transportation structure, over 1 million dead and millions of refugees. And it continues on day by day in that war-torn country. And it was illegal. It was unconstitutional. And Bush and Cheney are, in the minds of some lawyers, fugitives from justice. They could be criminally prosecuted. Obama refused to. How do you analyze their personality?
I would see them as more part of a structure. They by themselves do not come across to me as suffering from clinical severe symptoms, although I don't really know Dick Cheney. Sometimes the cold sociopathic types can come across as undisturbed, but I personally don't know much about them. I did raise alarms about the situation at the time. I was speaking at the World Economic Forum shortly after the Iraq War, and I did actually at that time diagnose the country of narcissistic personality disorder. Because, as you noted before, that we lack a societal psychiatry, an ability to diagnose conditions and states of society that mimic and parallel very much pathology within an individual. I saw more alarming signs from the system. But again, I didn't have a chance to personally examine them, and were I to do so, I might find some things. At the time, they personally did not alarm me. Although when we do fitness for duty exams, we work with the system they're supposed to function for. And so I don't know whether they would pass any fitness for duty tests.
Steve and David, do you want to weigh in here?
Yeah, Dr. Lee, Donald Trump is obviously under a lot of pressure now, despite what he says about he doesn't care about impeachment. It is a black mark on his legacy. And then there's a trial coming up. If you could predict what might happen under that kind of pressure for a personality like this.
Well, first of all, our predictions aren't predictions of the future. They're probabilities based on personality traits. And I think we can predict a very dangerous situation in that he will not go down quietly. We have placed ourselves in perhaps the most dangerous period right now because delaying all accountability and delaying impeachment, allowing him to swell his sense of power for so long, and now proceeding with impeachment. He's actually going to feel it in multifold outrage and desire for revenge. And so I think we need to take these dangers very seriously and not expect him to act like a normal person would, because his psychology is not normal.
Does he seem incapable of shame? Because I think about Richard Nixon, and it seemed like as bad as Richard Nixon was, he was capable of shame. And Donald Trump does not seem capable of shame at all. Is that the fair assessment?
Well, he is profoundly overrun by shame subconsciously, which is why he will never feel it on the outside consciously. So he will do anything to avoid that feeling.
That's why he doesn't apologize ever, too, probably.
That's right.
You know, his fabrication is distant from reality. I mean, he's still, no matter what the intensifying of storms, tornadoes, floods, drought in the U.S. and around the world, rising sea levels, visually melting glaciers, he still denies that it's a climate crisis. He says it's a Chinese hoax. And therefore, he is blocking the entire federal government from further research, banning the phrase climate change for the Centers for Disease Control, cutting enforcement, and actually letting the fossil fuel companies expand the greenhouse gases that are leading to the climate crisis. So I want to say this to our listeners, Dr. Lee, because this isn't any such kind of an aberration, a quixotic feature of a personality. It's distorting public budgets, for example, to protect people from floods in the Mississippi
there are real
area.
Consequences, yes.
Yes,
of course.
it has real consequences. Well, we're out of time, and I'm sure you're going to all continue and expand this. You're trying to educate people about personality features that affect their daily livelihood and the future of our country. And maybe some voters will do more of their homework before they vote for someone who has turned around and betrayed them because his lies were just that in order to get their votes.
Yes,
is there anything
thank
else
you
want to say?
I think the electorate needs to be informed and armed against all these psychological processes that are happening. So we're trying our best to educate the public, and thank you for helping us do that.
You're very welcome.
You know, I was an English major, and you read about Shakespearean
Yale,
tragedy.
Yale.
Yeah, as an undergrad.
Oh,
and
that's great.
Yeah, a long time ago.
Alma mater.
I'm much older than you, I'm sure. It was 40 years ago. But you read about these Shakespearean, these tragic figures who their greatest strength ends up to be their tragic flaw. And Trump's greatest strength seems to be able to just fend off. His psychological defenses are so strong that he's able to kind of fake his way through this. And, you know, I just wonder if there's going to be a Captain Queeg moment for him where he's, you know.
Oh, yes, definitely. Because when it's actually pathological level, the rallying will be very strong, but also the demise. So, yes.
When the general election comes, and we've discussed this before, will he even want to debate? Because when he was running against Hillary Clinton, he had to debate because that elevated him. But a debate could only possibly diminish him, and I wonder if he would take that risk.
So it seems he won't, at least from reading his tweets, because he says, you know, I'd be happy to debate. That means he wishes not to debate.
So we can pretty much, the rule of thumb is whatever he says, it's pretty much the opposite.
Yes. more opposite than someone intentionally doing so. That's
Right.
because of his unconscious processes.
I have a question. Is Nancy Pelosi correct in delaying turning the articles of impeachment over to the Senate? Just get him more. I'm sorry?
Yes. Yes, I feel that she's doing something right for the first time.
Because this allows him to turn on McConnell. This allows him to just be more frustrated and turn on.
Well, the dangers increase, that's for certain, but eventually it will be better because we're not causing him to swell in his power. I think people have been giving him more leeway, allowing him to strip constraining forces because he's been demanding it, but that's exactly what you need to not do, and she's containing him by doing this. Delaying impeachment was a terrible mistake. Having only 2 articles of impeachment, I really agreed so strongly with Ralph on this, and that's what made me reach out again, because I was so excited someone agreed with me, because that is so far from the reality that you end up, swelling him again, and you don't contain the person or set limits. So limit setting needs to happen by calling people out, by making the actions more commensurate to the actuality. And the fact is, he could have 4,000 articles of impeachment. So to only have 2 was detrimental, but now delaying handing over to an invalid trial, unfair trial, is very much the right thing to do, because it's commensurate with reality and it helps to contain the president.
By the way, our 12-count impeachment was put in the congressional record by Congressman John Larson on the day they impeached him. And you can go see it all at nader.org. 12 counts.
Okay, great.
12 counts. Yeah.
I have a quick follow-up. If you were brought in to advise Nancy Pelosi or the leader of the Democratic Party, whoever the nominee is for president, I doubt ethically, you wouldn't be able to do this, and you may not even be able to answer this question, but are there psychological devices you could use to incite somebody like Donald Trump to not be so much dangerous as self-destructive?
Oh, self-destructive. Well, I mean, you could, because it may, in the end, be beneficial to the public. And as I said before, our duty to the public comes first, comes before our duty to a public figure.
So if you were brought in by Nancy Pelosi and she said, what can I do to make him self-destruct? I doubt you're willing to answer this question, but there are devices they could rely on?
If that were the only way, then I would advise, because the greater good, we do this all the time in medicine. We triage. And whereas we would wish not to cause destruction at any level, if that were the only way, then I would do it. I am actually not looking to be doing the consulting myself, by the way. There are plenty of other psychiatrists who would step up and do that. But my role is mainly to educate the public. So if I were given the chance, I would not hesitate. I don't know.
Wow.
She said to people she wants to tie them up in knots. So she's very amenable to any kind of suggestion.
And that's a wrap. Tune in next week to the Ralph Nader Radio Hour when we discuss what's going on with Iran. Until next time.
Stand up, you've been sitting way too